Imagine you're a healthy young woman and suddenly you develop headache. You don't think much about it and you take treatment for that. But then afterwards you start developing hair loss, and then you develop a rash, and then there's fever, and then extreme fatigue, and then there's joint pain and stiffness. You might be thinking that you're in for a stroke of bad luck and you're developing a host of different diseases. But it might actually just be one disease or one diagnosis, and that's called lupus. Hi everyone, I'm Dr. Sharath, consultant rheumatologist practicing in Bangalore, and today we'll discuss about a diagnosis or a disease called lupus. What is lupus? Lupus or SLE is a chronic autoimmune disease. Let's break that term down. Chronic is any health condition or disease which lasts for a very long time. Autoimmunity or autoimmune diseases are diseases in which the immune system, the part of our body which serves as our army to protect us against infections, starts fighting against our own body. It might affect several organs in our body, but in lupus, usually organs such as the skin, hair, joints, and other organs such as the heart, brain, and kidney can be affected. What causes lupus? Lupus, the actual cause, nobody is certain about. But there are definitely certain things which predispose you to develop lupus and certain things which can trigger the lupus disease in you. Genetics or a family history of lupus can definitely add on to your risk or predisposition to develop lupus. Sunlight exposure, certain infections which can stimulate the immune system, as well as certain medications can act as triggers which can cause this disease to develop. What are the common symptoms in lupus? So the symptoms can vary significantly. Lupus is said to be a great mimicker. It can mimic several other diseases and can cause a host of different symptoms. However, there are some symptoms which are common. Rashes, especially on the sun-exposed areas of the body, which can include your hands and typically includes the area around your cheek and nose, which tends to appear like a butterfly rash. In addition, patients can have oral ulcers, patients can have a lot of hair fall, they can have fever and extreme fatigue. They can also have weight loss. They can also have swelling in the legs and puffiness around the eyes, especially if the kidney is involved. As I said, lupus is a great mimicker and it can mimic many other diseases. So doctors have to be really vigilant before making a diagnosis of lupus. Diagnosis of lupus cannot be made on a single blood test. So how is a diagnosis of lupus made? The diagnosis of lupus is made by doctors, particularly doctors who are trained in this treatment of this condition, who are rheumatologists such as myself, using a combination of several things. Number one, clinical signs and symptoms, meaning what are the problems the patient is facing, the nature of their problems, as well as when the doctor examines the patient, what he or she sees in the patient. Second is blood tests. There are several blood tests which are used for the diagnosis of lupus. However, they are not very accurate in the sense that they have a high rate of false positivity, especially a test called the ANA or the anti-nuclear antibody test. What does false positivity mean? False positivity means that patients who do not have lupus can also have this positive test. So doctors have to be vigilant and include other factors when making the diagnosis of lupus. Other blood tests like anti-dsDNA or double-stranded DNA, as well as blood tests called complements, are used for the diagnosis of lupus. Urine tests can be ordered by the doctor if they suspect that you're having kidney involvement. Several other tests are also used, including X-rays, CT scans, MRIs, or echoes, depending on whether the doctor feels that the patient might have brain or heart involvement. All of these tests, as well as the symptoms or the problems that the patients are facing, have to be combined and assessed together to be able to make a diagnosis of lupus. Early diagnosis and treatment are essential if we want to avoid the complications that lupus can cause. Lupus can really wreak havoc on somebody's life. Awareness is the key to the early diagnosis of lupus. Stay tuned for the next video in which we will discuss about lupus treatment, what tests are done, and what medications are given. If you found this video helpful, then please like this video and subscribe to this channel. By subscribing to this channel, you'll help increase awareness about this condition, as well as you'll be able to get regular updates from us.